Huntsville infectious disease specialist Dr. Ali Hassoun joins us now to talk more about the issues. Thank you so much for being with us tonight.
Thank you for having me.
Dr. Hassoun, Colbert County just announced that students will be in class 2 days a week and do virtual learning 3 days a week. Lauderdale County is doing a similar schedule. What's your perspective on this?
The plan of cutting down of the number of students and reducing the occupancy of the classroom can definitely help of reducing transmission. So minimizing the number, getting clusters of those together, 5 or 10 at the same time rather than 20, these all will help some. I still have the concern of if any of them got exposed and we're not going to have symptoms, for example, for any of these kids till 3-4 days later, they can still transmit it to their teacher, they can still transmit it to their family, and that can be a major issue if any of that happen. So it can help some, but I'm not sure if this is going to be able to prevent the transmission completely.
Are the different protocols that schools are taking to prevent the spread or reduce the spread of the coronavirus effective?
I think it does help in a way, but I think what's the most important to know is we probably, if we want to open up schools like how we open up colleges, these students are going to need to be tested on a regular basis to know if they are infected or not, because some of them can be asymptomatic, or some of them for the first few days doesn't have any symptoms. And imagine a lot of these students going to be mixing, not just in the classroom, they're going to be mixed with families, friends outside.
We reported earlier today that Alabama's test positivity rate is decreasing, and this is the second week in a row that test positivity has dropped in this state. What's the takeaway?
So that's encouraging, I can tell you. It's definitely encouraging to have a lower positivity rate. The reality is, if we want to open up schools, or if we open up the state or the city, we really need a positivity rate less than probably 5%, but to be perfect will be much less than that. At the moment, we haven't reached that stage.
We're also seeing a decrease in the number of people who are getting tested themselves. What's your perspective on why that might be happening?
Yeah, so I think there's several parts in this where some people now has been through the pandemic, unless if they are really symptomatic, they don't want to get tested. Some of them want to avoid to be tested because if they are positive, unfortunately, they don't want to, avoid going to work or avoid going to school and stuff. So I think part of it is that. On the other part, yes, there might be a reduction in cases, and there might be some, light at the end of the tunnel where we're seeing reduction in demand. So hopefully that might mean reduction in infection.
President Trump says that he believes we will have a vaccine by the election. How likely is that?
Yeah, that's, I think it'll be very difficult to have by the election, in early November to have vaccine available and given. And the reason for that, whatever vaccine studies, really the last only few weeks just started, or around July started to enroll patients to know efficacy. To know efficacy of a vaccine and safety, you're going to need to wait at least 6 to 8 weeks to know if there is any, safety issues. And then you need to take a little bit more than that, about 3 months, 4 months to know clinical efficacy. The moment you know any of that, then you're going to need to analyze data, get more information, and then you say, well, it's beneficial, and then you're going to start making the vaccines. So this is just going to take time. Now we're August. I don't see it in 3 months. We're going to have everything available so we can vaccinate everybody. It'll be very tough.
Anything else that you would like to share with us tonight?
The main concern for us at the moment is the hospital getting a lot of pressure, staff-wise, between nurses, respiratory therapists, physical therapists, cleaning, environmental employee who help with the cleaning, dietitians, secretaries, physicians, all of them is getting into a lot of stress and pressure because we want to help our patient, we want to do everything for our patients, but it's getting where all these beds are full, patient really getting sick, some dying, and it's disheartening for us to see all that. We need the help of our community to reduce the cases, and it's in their hand to help us out in this. So please, as a community, we need to work together to help us out in this.
Dr. Lee Hassoun, infectious disease specialist with Huntsville Hospital, thank you so much for your time tonight.
Thank you. Appreciate it.